Hello, everyone. It's Dr. Atkinson. Today, we're going to talk about epixtaxis, more commonly known as a nosebleed. Epixtaxis is a hemorrhage from the nose caused by rupture of tiny distended vessels in the mucous membranes. While bleeding can technically occur anywhere in the nose, most episodes start in the anterior septum. This is where three major blood vessels converge: the anterior ethmoidal artery, the sphenopalatine artery, and branches of the internal maxillary artery. Together, this area is often referred to as Kieselbach's plexus. Risk factors. Epixtaxis can be triggered by many different factors, both local and systemic. Some common ones include local infections like rhinitis or sinusitis, trauma, including nose picking, fractures, or forceful blowing, drying of the nasal mucosa, inhalation of corticosteroids or illicit drugs like cocaine, systemic causes like hypertension, arteriosclerosis, liver disease, or thrombocytopenia, medications such as aspirin, tumors or hereditary conditions like Rendu-Osler-Weber syndrome, also known as hereditary hemorrhagic telangiectasia. Medical management treatment depends on the cause and location of bleeding. Most nosebleeds are anterior and can be managed conservatively. Here's the initial approach. Have the patient sit upright and tilt the head forward. This prevents swallowing or aspirating blood. Direct the patient to pinch the soft part of the nose against the septum for 5 to 10 minutes continuously. Nasal decongestants, like phenylephrine spray, may be added as a vasoconstrictor. If bleeding persists, the provider will examine the nose under good lighting, often with suction. Visible sites may be cauterized with silver nitrate or electrocautery. Sometimes Surgicel or gel foam patches are applied to help with clotting. When the site isn't easily located, the nose may be packed with gauze coated in petrolatum or antibiotic ointment, with balloon catheters, or with compressed nasal sponges that expand once moistened. These may need to remain in place for 3 to 4 days, and antibiotics are often prescribed to reduce the risk of infection. Nursing management. The nurse's role is critical. We monitor the patient's vital signs, provide tissues and an emesis basin, and reassure the patient because nosebleeds are often frightening. We must also continuously assess airway and breathing. In rare cases of major hemorrhage, IV fluids and close monitoring with cardiac and oxygen saturation equipment may be required. Once bleeding is controlled, the patient needs clear self-care instructions. Avoid vigorous exercise, hot or spicy foods, smoking, or vaping for several days. These all cause vasodilation and increase rebleeding risk. Don't blow the nose forcefully or pick at it. Use humidification to keep nasal passages moist. Learn how to apply direct pressure for 15 minutes if bleeding recurs. And if the bleeding doesn't stop after pressure, seek medical help right away. That's our overview of epixtaxis. Remember, while many cases are minor, epixtaxis can sometimes be a sign of systemic illness and needs careful evaluation.